Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Groin hernia, and we are looking at the NYHUS classification. So this is divided into 4 categories. So the first category will include the indirect inguinal hernias. So it is the indirect inguinal hernias, and that is the internal inguinal ring is normal. The internal inguinal ring is normal, and example will be the pediatric hernia. So pediatric hernia is the example. The second type is the indirect inguinal hernia. This is again the indirect inguinal hernia. So here the inguinal ring is dilated, but posterior inguinal wall is intact. So the internal inguinal ring, this will dilate. So the internal inguinal ring is dilated, but the posterior inguinal wall is intact. Posterior inguinal wall, this remains intact. So to repeat, the indirect inguinal hernia, the internal inguinal ring is dilated, but the posterior inguinal wall is intact. Next point is the inferior deep epigastric vessel is not displaced. So the inferior deep epigastric vessels, they are not displaced. It is not displaced. Now we move on to the third type. So third type is nothing but the posterior wall defect. It is a posterior wall defect. Whereas we saw in second type that the posterior wall is intact. So in posterior wall defect, there are again subcategories. A means it is a direct inguinal hernia, and B is for the indirect inguinal hernia. So that is, here the internal inguinal ring is dilated. So this is dilated and medially encroaching on or destroying the transversalis fascia. So it is medially encroaching. So medially encroaching on or destroying the transversalis fascia. Transversalis, and destroys the transversalis fascia. And the destruction is of the transversalis fascia, and this is of the Hasselbalch's triangle. This is nothing but of the Hasselbalch's triangle. So what is the example here? The examples, it includes, there is scrotal, next is sliding, and then there is also the pantaloon hernia. Now lastly, what is the C variety? So type 3C. So type 3C, it stands for the femoral hernia. This is nothing but the femoral hernia. Lastly, we move on to the category 4. Category 4 means it is nothing but the recurrent hernia. It is the recurrent hernia. So recurrent hernia, it has 4 varieties: A, B, C and D. So your A stands for it is direct. So A means it is direct. B means it is indirect. C means it is femoral. And D stands for it is combined. To learn and grow daily like this, please do subscribe.